my name is Kate, I'm a physical therapist, and today let's talk about ankle sprains. Ankle sprain is a very common injury and it is relatively easy to treat. There is, however, just one tiny hitch. Most patients finish their rehabilitation when they are able to walk without pain, which is a huge mistake because leaving our ankle joint at this stage increases the risk of re-injury in the future. In order to fully rehabilitate our ankle joint, we need to rebuild proprioception within the joint, and that requires a bit more advanced exercises than just walking. But let's start from the beginning. An ankle sprain is an injury that affects people of all ages, genders and levels of physical activity, starting from couch potatoes and finishing on professional athletes. It occurs when the ligaments that support the ankle stretch beyond their limits and tear. This usually happens when you put your foot awkwardly, for example, by stepping downstairs, jumping or shifting your body center rapidly. The symptoms of the sprained ankle are pain, redness, warmth, swelling, bruising, instability and trouble walking. There are three types of ankle sprain, the location of which is determined by the mechanism of injury. First, the most common, is the lateral ankle sprain or inversion ankle sprain, in which the ankle rolls outward and tears the lateral ligaments. Second type is a medial ankle sprain or eversion ankle sprain, in which the ankle rolls inward and tears the deltoid ligaments. This type of ankle sprain is much less common. The last type of ankle sprain is called a syndesmotic sprain or high ankle sprain. In this type of injury, the lower leg and foot externally rotates, damaging tibiofibular ligaments. Ankle sprain is classified based on clinical signs and functional loss as follows. Grade 1, which is a mild stretching of a ligament. Grade 2, which is more severe injury involving incomplete tear of a ligament. And grade 3, severe one, associated with complete tear of a ligament. In the first few days after injury, we focus on reducing pain and swelling. Very common is the RICE approach, which is rest, ice, compression and elevation. It has been commonly used in the first 2 to 3 days following injury, although it is worth saying that evidence on the effectiveness of RICE alone is still lacking. In the acute phase of ankle sprain, patients can use non-steroidal anti-inflammatory drugs to reduce pain. However, the use of these drugs may delay the natural healing process due to their inflammatory suppressed mechanism. The integral component of the treatment is rehabilitation, including exercises and mobilization techniques. And of course, surgical procedures are performed in the case of severe damages. Until recently, in some countries, it was a standard procedure for ankle sprains to put a leg in the plaster. Today we know that long immobilization is very harmful for the ankle joint. If the leg is immobilized for a long period of time, the muscles will atrophy and the proprioception within the joint will be disturbed. The later we start to move our ankle, the greater the risk of repeating injury. That is why we should start rehabilitation as soon as possible, preferably second or third day after the injury. But of course, I am talking here about cases which do not require surgical intervention. First exercises you should do are active movements in the painless range of motion. Do not take any painkillers before you start exercising so you can feel your body's reaction. Do not be afraid, you will not hurt yourself. Perform plantar flexion, dorsiflexion, inversion, eversion. Combine inversion with plantar and dorsiflexion, and combine eversion with plantar and dorsiflexion. Finally, make circular movements to the right and to the left. Perform all of it only in a painless range of motion. At the beginning, you will certainly be unable to do the full range of motion, but keep doing this exercise a few times a day, each time increasing the range. Second thing you can do is a cross-fiber friction massage. Cross-friction massage is a technique to promote proper ligament healing. The scar region of the ligaments have greater cellularity and the collagen fibers are aligned better when this technique is used. We can perform a cross-fiber massage on any ligament we want. Regarding inversion ankle sprains, we got 3 ligaments over here. Regarding eversion ankle sprain, we got 3 ligaments over here. And regarding high ankle sprain, we got 2 ligaments here that can be damaged. I use one finger and apply a direct pressure backwards and forwards across the ligament, not along the ligament. For example, if we think about anterior talofibular ligament, which is usually torn in the inversion ankle sprain, here is the direction of the fibers. So I perform massage like that. Do it for 1 minute on each ligament, few times a day. This massage may be uncomfortable, but shouldn't be painful. Next thing is a weight bearing, and here the rule is simple. We start to load the lower limb right after the injury. It has to be painless, and we gradually increase the load. Just start by placing your foot on the floor while sitting in a chair. If it is okay, lift your heel and then lift your toes. Then lift the medial part of the foot from the floor. Next, lift the lateral part of the foot from the floor. To increase the load, lean on your knee and press your foot against the ground with the weight of your torso. Then, if it doesn't hurt, load the toes, the heel, the lateral part, and medial part of the foot. Now, stick your foot to the ground and move your knee to the left and to the right. Stand on both legs and distribute your weight equally on the right and left. If it is okay, slowly shift your weight to the right and left foot. Lift your feet off the ground. Standing on both legs, try to step on your toes and on your heels. Now load the lateral parts of your feet. And now load the medial parts of your feet. Stand on one leg, the injured one, and if you do not feel any pain, try a half squat. If it is okay, step on the toes and step on the heel. If you have trouble keeping your balance, you can lean on the chair or table. You should also practice a correct foot rolling. Your injured leg should roll starting from heel strike through full loading stance and finish with pushing off the toe. You should repeat this pattern many times. And now, well, you're ready to go. Depending on the degree of your sprain, it will take you from a few days to several weeks to resume normal walking without pain. And here at this stage, most of the patients forget that they had a sprained ankle at all, which is a huge mistake, because getting only to the point where you can walk without pain is not really the end of rehabilitation. There is the most important issue left, which is to reconstruct the proprioception within the joint. In fact, our ankle joints were not designed to walk on a flat surface. Our ankles are constructed to withstand jumps and runs in a variety of angles. Therefore, if you end your rehabilitation at the stage where you can walk on a flat surface without pain, you run the risk of repeated injury. You need to do much more than this to regain full functionality within the joint. How to do it? That is why we are here. Start by walking on uneven terrain. There should be ups and downs, so that you have to put your foot at a slightly different angle each time you take a step. When you warm up the joint a bit, start jumping training. Draw a circle around you and mark the hours 12, 3, 6 and 9. Draw a cross in the middle. Jump on 12, cross, 3, cross, 6, cross, 9 and cross. Try to do this exercise with your eyes closed. If you coped well with this exercise, do it on one leg, the one after injury. First with eye control, then with your eyes closed. Draw a straight line several meters long. Jump on both sides to the right and left. Then jump once with your toes pointing to the sides and once to the center. Then jump by spreading your legs wide and then crossing them over the line like scissors. Finally, jump with 180 degrees turns, once through the left and then through the right shoulder. Finish the training by running on uneven ground for a few minutes. That was fun. You should do this jumping, running training at least once a week, and I can assure you that if you train your ankle joints like this, the risk that you are going to sprain your ankle in the future is going to be significantly reduced. At the end, I would also like to tell you a few words about shoes, because there is a myth that if you sprain your ankle, you should wear high shoes that reach above your ankle. It's totally opposite. The shoe shouldn't restrict the natural movements of your ankle, which is a flexion, extension, pronation and supination. That is why the high shoes aren't really the best option, in my opinion. As for the sole, it should be flexible. So if you take off the shoe, you should be able to flex it easily and bend it easily. And the part behind your heel should also be flexible, so your heel can position freely in valgus and varus position depending on the movement you make. Okay, so that will be all. If you like the movie, leave me a thumb up, leave a comment and take good care of your ankles. See you next time. Bye.